Have you ever wondered what happens to your brain during a car crash? Why do some people experience memory loss, balance issues, vision, and attention problems following a car crash? I'm Dr. Hope, and in the next few minutes, I'm going to show you what happens to your brain in a car crash. Your brain is incredibly complex. Each lobe of your brain controls specific functions like vision, balance, and thinking. An injury to one of these lobes can impair its function. Let's take a closer look inside the brain. Inside the skull, a thin layer of cerebrospinal fluid cushions and protects the brain from daily activities and movement. Unfortunately, it does not protect the brain during high-impact or sudden forceful movements like car crashes. And inside your brain, there are billions and billions of neurons, and these neurons communicate with each other through axons and synapses. During a car crash, the occupant's head can violently move back and forth. When this happens, the brain bounces off the skull, sending shock waves throughout the brain. This is known as a coup contra coup injury. These shock waves can stretch or tear the axons, disrupting communication with neurons, reducing normal brain function. This is called diffuse axonal injury or axonal shearing. This altered communication between neurons can present symptoms such as headaches, dizziness, balance problems, ringing in the ears, and memory loss, to name a few. Diagnosing a TBI is very complicated, and for that reason, they are often misdiagnosed. We perform a battery of tests to help determine if a patient has a TBI. Our testing paradigm can take up to 3 hours to complete. At Horizon TBI, all diagnostic tests are performed with sophisticated computer equipment to ensure accuracy and repeatability. There are 5 components to our diagnostic paradigm of testing. During our balance test, the human body uses 3 sensory inputs to maintain balance. They are vestibular, somatosensory, and vision. During the posturography testing session, a series of tests are administered that measure how well a patient can maintain balance under different conditions. Our eye tracking technology offers an objective, reliable, and quantifiable way of differentiating between individuals with different severities of concussion and guidance on the patient's path to recovery. Our neurobehavioral and neurocognitive examination measures clinical assessments of thinking, reasoning, and judgment, including acquired knowledge, attention, language, memory, planning, problem solving, and visual spatial abilities. We then measure the brain's electrical activity and record the brain wave frequencies using a sophisticated quantitative electroencephalogram. A QEEG is a sophisticated tool that measures electrical activity and records brain wave patterns to create an image. Green is normal, red, blue, or shades of red or blue are abnormal and indicate a dysregulated brainwave frequency commonly seen in people suffering from TBI. The results of the QEEG are then compared with the diagnostic test results to determine the extent of the TBI and the precise location. Our board-certified neurologist reviews all test results before consulting with the patient. A specific treatment plan is designed for each patient, consisting of vestibular rehab, cognitive rehab, ocular rehab, and neurofeedback to improve neuronal communication. Let's take a look at what neurofeedback looks like. Neurofeedback uses a learning method called operant conditioning to help retrain the brain by providing rewards to your brain. Every time the brain performs the correct activity, it receives a reward, making the screen brighter. As the patient progresses, we adjust the threshold, making it more challenging for the brain, further increasing axonal communication. A follow-up QEEG is performed every 6 weeks to evaluate the patient's progress and determine the need for further treatment. As you can see, testing and treating TBI is very complex and must be precise. Obtaining a detailed history is essential, and starting neurofeedback sooner rather than later is critical for patient recovery. It is well documented that untreated TBI can lead to the early onset of dementia and Alzheimer's. It is not uncommon for a patient suffering from TBI to undergo several months to years of neurofeedback to successfully reverse the consequences of a TBI.
To schedule an appointment, call 800-631-4885 today.